So my name is Alexandre. I tried before, the mic was off, but I said a couple of words in French. Je m'appelle Alexandre, j'ai vécu au Portugal. Alors, je parle un peu de français parce que là-bas, on apprend de français à l'école. C'est presque tout que je parle en français. Alors, I'm going to go back to English now. So I'm going to talk a little bit about what we think in our lab at the University of São Paulo. What we think it's one of our main challenges into applying machine learning throughout the world. Okay, it's the fact that us in our lab and labs on AI in healthcare throughout the world have been finding out that it's really hard to transfer algorithms. Okay, learning patterns even throughout Brazil, even throughout the same city in Brazil, we get a major drop in predictive performance when we move those algorithms around. Okay, and how do we make sure that those algorithms are going to work in the areas that those algorithms are going to be the most needed, right? Which is on the remote areas of the world. We have a bunch of cities in Brazil and throughout the world where you have only one physician for the whole city, right? The physician doesn't have a cardiologist to refer those patients to, doesn't have a pneumologist, and so on. So this physician has to make decisions for every single patient in his or her city. With machine learning algorithms, this physician is going to have the best specialists in the world, the best cardiologists in the world, the best pneumologists in the world, ready to answer any questions that this physician has. Okay, so we do believe that on those remote areas of the world are going to be the areas where those algorithms are going to have the biggest impact. Okay, they're also going to help patients in Paris, in Sao Paulo, in Boston, but you already have pretty good specialists on those areas, right? So the quality of the decision is going to improve, but it's not going to improve as much as the decisions in remote areas, right? It's like an Uber driver here in Brazil and Lewis Hamilton driving a car here in Brazil, here in Sao Paulo. They're probably gonna end up at the same place at the same time because they're both going to use Waze, okay, which is a machine learning algorithm. Okay, so in the end, the decisions are going to be very close, no matter how good the background of the physician is. But in those remote areas, the increase is going to be huge, right? On the decisions. So we have a huge opportunity to decrease inequalities in healthcare throughout the world, but we also have many challenges, right? In our lab, we have been identifying three main challenges for putting those algorithms into those remote areas. First, we collect less variables in those remote areas. Are those variables enough to help physicians make intelligent decisions, to improve the decisions in those remote areas? Second, can we retain predictive performance if we develop an algorithm that learns from patients from areas where we have a lot of data, right, such as Sao Paulo? And then if we try those algorithms in those remote areas, does the predictive performance remain close? Okay. This is the second one. The third one is how do we get those algorithms to be available to those physicians in those remote areas where sometimes you do not have an electronic medical record, or when you do have an electronic medical record, it doesn't, the internet doesn't work so well, and the system doesn't work, and so on. So it's those three main challenges that we have been working in our lab, which the big data and predictive analytics in healthcare lab at the School of Public Health at the University of São Paulo. So the first challenge, do we collect enough data in those remote areas? We have been finding out that we do, right? For especially birth data is pretty good throughout Brazil. Every single birth in Brazil collects data from the newborn and from the mother, such as birth weight, such as gestational age, education of the mother, and so on. And we also have some pretty good data on mortality. Okay, so in this study, we analyze exactly those kind of data, right? Those data that are collected for every single person in Brazil, no matter where you live. It has like a 96, 97% coverage of birth data and mortality data. So through a partnership here with the Municipal Council of São Paulo, we got the data from every single live birth in São Paulo from 2012 to 2017, and the information if each of those births ended up in a neonatal mortality, right? If they ended up dying in the first month of life, in the first 28 days, right? We call it neonatal mortality. And we train algorithms with this data from live births, trying to predict which of the babies would end up dying in the first month of life. So how do we do this? We train those algorithms with data from 2012 to 2016 with full information, right? So that the algorithms could learn the rules. And then after the algorithms learned the rules, we brought data, what we call machine learning test data. We brought data without saying the right result, and then the algorithm had to use those rules to predict the probability of each baby and then ending up dying. And then we checked if it was correct or not. So here in this graph is the results from the test data, where in the x-axis is the estimated probability that the algorithms gave. In the y-axis, the actual results. The full line is the perfection, and the pointing lines are the results of the algorithm. So mostly perfect, close to perfect. So when those algorithms said that the baby had a 90%, for example, probability of dying, we ended up checking and it was around 90%. When it said that it had a medium probability, 50%, we checked, and it was among those babies, 50% of those ended up dying. When it said like 10%, we checked, and among those, around 10% ended up dying. So those algorithms had what we call a good calibration. So we were able to give the probability and showing that it's the right probability, right? So instead of just saying, oh, this baby's going to die, this baby's not going to die, we were able to say, okay, this baby has a 91% probability, and when we checked, it was really 91%. Okay. So using routinely collected data. So this data from live births and from that is collected everywhere in Brazil, around 96, 97% coverage. So we do collect quality data on those remote areas, enough to develop machine learning algorithms to help with decisions in those areas. Second challenge, what if we develop an algorithm in one place, does it work somewhere else? Okay. In this case, we have been seeing that it doesn't. Okay, there's a major drop in predictive performance when you develop an algorithm in São Paulo and you try to move and you try to predict for the same disease, for the same issue, the same thing in the countryside, for example. Okay, why does it happen? Because patients are diverse, right? Not only patients, but the whole system is diverse, right? The healthcare professionals, the availability of exams, the risk factor of the patients, the genetic, the socioeconomic background of the patient, so on. So everything is very different, okay, throughout the world, especially in Brazil, which is the most diverse and unequal country in the world, which makes total sense, right? That those algorithms do not work the same. It's like a human specialist, right? If a human specialist comes to São Paulo to do a residency in cardiology, for example, and it learns with the reality of the patients of São Paulo, when he or she moves back to his or her city, for example, in the countryside, this physician doesn't use the same exact rule sets that he or she learned here in São Paulo, right? This physician has to adapt to the realities of the countryside. So it doesn't make sense to use the exact same rules. So what we have been working on from these studies, we have been working on a technique called transfer learning, right? So the idea is you develop those algorithms where you have a lot of data so that the algorithm learns the basic of this disease, okay? And then you fine tune it for different realities, okay? We have a few masters, PhD and postdocs in my lab working on this. How do we fine tune those algorithms for the different realities of the most diverse country in the world, which is a huge challenge. But we're very excited about this type of study because we believe that if we fix this for Brazil, we fix this for the world. Okay, if we get an algorithm that works well, that is able to adapt to the different realities of the most diverse country in the world, this algorithm will see everything, okay, about this disease. We'll know every single nuance, every single risk factor, every single characteristics that leads to the diseases, to this disease or the prognosis of this disease. So we're very confident that those algorithms are going to be the best in the world, okay, because we will truly understand the disease instead of just seeing a specific kind of patient.
Alexandre,
okay? You've
got 5 minutes left.
Yes, thank you. And the third and final challenge is how do we get those algorithms to work in those remote areas of the world where you do not have an electronic medical record, or when you do, the internet doesn't work and so on. So in this study, we developed a mobile app, right, to run on the physician's smartphone, because even though the region maybe sometimes doesn't have an electronic medical record, the physician has a smartphone. Okay, so we developed this app to run on the physician's phone, and then we found a very high acceptance rate. So this could be the solution to get those algorithms to work. Just make a mobile app and run those algorithms within the physician cell phone. Okay, and we have been finding a huge acceptance for machine learning algorithms for healthcare workers. So sometimes people outside of healthcare usually tell me, "Oh, okay, so Alex, it's pretty cool what you're doing, and so on, but the physicians will never accept this." This is not what we have been seeing lately, right? The physicians, when they understand what is behind those algorithms, which is help them to improve clinical decisions, to resume every single information that they get into what the physicians would like to get as information. For example, what is the probability of this patient having this diagnosis that I think he or she has? The physicians are usually very excited about this possibility of using those algorithms into clinical care. So all of this is thanks to the amazing teams that I have in my lab. I have around 30 researchers from masters, PhD, undergrads, postdocs, and so on, where we develop those algorithms every single day. Here is my contacts, and here is the Instagram of our lab. If you're interested into artificial intelligence in healthcare, the researchers in my lab do a lot of scientific communication work on the field. And this is my email if you want to send me a message. So thank you.